thank you very much for the interest in this panel discussion. Now that we have lived through a pandemic, a session on not just health issues, but also where does health journalism intersect with all these health issues is but inevitable. We just cannot escape the topic, or we cannot afford to ignore the topic, since I don't think really COVID is yet over, and we have been seeing many of these issues that we will discuss today play out again and again. They have played out in the past, and they are playing out now, and they will hopefully not play out in the future if we have some suggestions to offer during these panel discussions. So without much ado, because we have a very short 45-minute session, I will first request each panelist to give a very brief introduction.
Hi, good evening everyone. I'm Kavitha Singh, a physician by training, and during my life worked in the interface of drug development, vaccine development, public health, scale up, so across different sectors. Thank you, pleasure to be here.
Hello everyone, my name is Banjot. I'm a health journalist with The Wire, doing this for about close to 15 years now. Nice to be in this institute for sure, because we have been speaking to some of the scientists here, of course, what we call off the record. But I asked one of them, can we come to National Institute of Immunology? He said it will be very difficult. So finally, great to be here, and look forward to hearing from all of you.
I'm Jaya Shreedhar, like Kavitha, also a physician by training. I teach at the Asian College of Journalism as adjunct professor of health journalism. And I also work as senior health advisor with Internews, holding charge of Asia, Europe and Eurasia. And very happy to be part of this inaugural initiative by the SJAI. Such a proud moment, and I'm sure this conference is really going to swell in numbers. It ought to, because I really think we could do with at least about 100 times the number of science journalists that we have in this auditorium.
Hi everyone, I'm Mahima Jain, and I'm an independent journalist. I cover gender, environment and health from an inequity and justice perspective. I primarily write long form of feature stories for several publications in India and overseas.
I have to say, I was special correspondent covering health and medicine for Frontline, just in case you think I'm from the opposite camp.
So we kick off this session the way I structured it is we are going to look at 4 key issues. One is neglected diseases. The second is gender and reporting on gender in health. The third will deal with people's experience with health systems, but to avoid an overlap with either gender issues or neglected diseases, this point will focus on access to health care and how poorly thought out laws impact the health outcomes. And lastly, we will have Banjot talking about her experience struggling with all these issues in what it was certainly not a neglected disease by any stretch of imagination or definition. It was an over-focused infection. I'm referring to COVID-19, but how some of these issues remain the same without, it's immaterial whether it is a neglected infection, whether it's a poorly understood issue or not, whether there is access to health care or not, how these issues still remain relevant. So Kavitha will first, I'll request Kavitha to start by talking about neglected diseases and how they're receiving minimal attention in the media and what more could be done by health journalists to pay more attention to this particular basket of diseases.
Thank you again for having this complex topic on the agenda. The very fact that neglected disease is not a disease. They're a group of so many diseases, and if we go by the classic definition, it's a WHO classification on what do they call as neglected. And you will always hear our politicians fighting against it. They say, but it's not neglected for us. But they are neglected, and they're neglected because once they are really seen as the marginalized population. And these are the diseases which are a group of diseases. They are viral diseases, bacterial, parasitic, fungal. So for a journalist to handle them as a disease is certainly a very big challenge. I really want to firstly, acknowledge that even for all of you, it's not a task that, okay, I'll cover neglected disease. It might just be the whole spectrum of your coverage because there's just so many of them. There are 20 which WHO classifies, and 12 of them are in India. And you can imagine the burden of this disease. That, and if you see 2016 data, you will see this 11 of these in India in absolute terms had the maximum number of cases. But still, we would not read about them much in our, in any of whether our digital media or print media. But I can, empathize with the journalist when we talk about neglected diseases because, like I said, they are different. The way they are transmitted, the way the social determinant factors, the intersectorial, interministerial factors, which all impact on the spread and on the non-control of these diseases is complex. We realize that our country has so many other competing problems, TB, HIV, malaria being top of them. So these neglected diseases don't even find a mention. We still, I think, out of all the 20 diseases or 12 in India, we hear about our government talking only about leishmaniasis and lymphatic filariasis. We don't even acknowledge we have mycetoma. We don't acknowledge that we have never worked on treatments for rabies. We don't acknowledge that for snake bite, we are just stuck on snake venoms. We are not looking at any other modality of treatments. So what I'm saying is I'm acknowledging you have a complex task because there are competing priorities. It's a complex disease. It's a complex group of diseases. Not much data. You will not find much data, local data. You will not find any, roadmap, any white paper from the Indian government coming out saying, okay, these are the neglected diseases we're going to focus on for next 5 years, 7 years. This is a strategy for control, for R&D, for scale up, for implementation science. So all that is missing. So the first factor is acknowledging it's complex for the journalists to tackle. Then the second point naturally comes is, do I have any suggestions? Then, I'm not really preaching to the preachers, you guys know what your job, but little bit more differently you might want to do here is really go down to the community, because this is the problems which poor communities face. So if you can go down to that level to understand their challenges, if you can speak to the community health workers, really speak to the experts. We say we will remove lymphatic filariasis by so much here. Do we really have all the tools? Do that little more deeper investigative journalism from the experts. Many of them are not. There are very few experts in these diseases. You'll have handful of experts when you talk about snake bite. Very few of them. A very handful of experts when you talk about mycetoma. I don't know how many of you even know about mycetoma. It's an infectious disease which can cause amputation, limb amputation. It usually happens in the limbs because you get it through a thorn bite, a thorn which has a fungal or a bacterial on the thorn. Again, mycetoma is of two types. So my messaging is that please try to speak to experts, try to find out, are we really, ask them, are we really on the right track? Are the punchlines given out by our political state affairs or central people, are they really well researched and backed up by data? Our modelings, are they supporting the sort of commitments we are making of disease control or elimination? Are we there on track? Are we sustainably eliminating the diseases we are working on? So ask these questions. There might be also a way to learn from, cross borders. And in fact, it's quite surprising, but Bangladesh, Sri Lanka, Thailand have done better than us. Honestly, they've done better than us in control of neglected tropical diseases. So can you form some inter-country border groups to understand what they did? Because normally we are not very proud of learning from our neighbors. Honestly, we are not. But it could be an area where journalists are not. You people are much more open, much more collaborative than the scientists. I come from the scientist background. So anything else I have as recommendations would be have more regional, if you can see more regional seminars or regional conferences, try to dig in more data from WHO. Of course, you'll get some more data from WHO, would be more authentic. Of course, our own national control programs, the NCBDCP, the ICMR, they could be helpful. But once again, I'll just reiterate, please do ask questions for scientific evidence. Don't take any press release which comes out, this is it, please do go deeper into that. How is it, when it was made, through which drugs it's being made, is that drug addressing all the complex stages of these life cycles of these diseases? Because when you realize when there is any vector-borne disease, you'll have 3-4 different stages. You'll have a different stage, how it will multiplies in a vector, how it is transmitted, how it multiplies in the host. So which level your drug is acting, which level your diagnostic is acting. So just go a more deeper. That is certainly one of the messages I'm giving. And of course, DNDi, the organization I represent, is the Drugs for Neglected Disease Initiative, is an R&D organization. So as an organization, we are very happy to support. So we don't work on all the 20 diseases, we work on 7, 8. But considering we work in this space, we are happy to share whatever facts, figures, true information which is available with us. And I believe our teams have been working with the journalists and the space. And in fact, it's been very encouraging to see, after we have started interacting with so many journalists, your uptake for your appetite for this complex disease has been very nurturing and positive spin to our work. And the last message which I like to give, do I have a minute? Is that you will have multiple stakeholders. So please have a different articulation, a different curation of message for each stakeholder. So if there's a missing drug and you want to entice or incite the researchers, pharma companies, diagnostic companies, you'll have to create a very different story. Versus if you want to talk to the community to scale up a control program, that will be very different. Versus a policy advocacy toward the government. So your task is challenging, but it certainly is doable. Thank you for that time.
Health systems, which is gender or other gender inequities, how it has a huge impact on access to health care, and how it's a very good indicator of the kind of health inequities that we are facing. She will elaborate more on both gender issues and about health journalists reporting on these issues.
Thanks, Padma. Sometimes I think to myself, is gender and health, has it become something stale and stereotyped over the years? And sometimes when I read all the coverage, I really get delighted and thrilled when I see at least 1 or 2 pieces where you have men reporting on inequities in access to healthcare among women, and putting themselves in the woman's shoes and bringing out the perspectives of those men who are in a transition away from their earlier generations, very deeply entrenched cultural supremacist views, and trying to be companions to their wives and taking joint decisions. And how can we as journalists help that transition? I would love to see gender and health reporting cover those aspects, where women are, the chiefs of units, and the men are there as ward boys and health assistants. Not always that the unit chief in a TB unit is, the chief medical officer is always a man, and all of the, nurses and all of the community health workers are all women. So I think we've done enough of those stories. We've done lots and lots of negative, stale, stereotype stories. It's good that we've managed to flag up the gross inequities in access to healthcare when you compare access to healthcare among men versus women. Very important stories. We can't afford to let those slip under our radar. But I ask myself, are we doing the gross injustice of priming audiences to expect exactly that? Are we, sort of seeding those and reinforcing those feelings of helplessness by stereotyping women across India and across the world as always second-class citizens who don't know enough about health, who don't care about their health, and if they care about their health, they don't bother to seek help. So I would love to see, this is just my personal feeling because we had a bit of an argument about it. So it's also good, I think, to flag up those stories that talk about the power that women are exercising in their health choices, both within the system and outside it. I think it's very important to prime audiences to expect that, to normalize it, so that more and more of those kinds of stories come to the surface. And we should look for data, and we should look for those kinds of evidences, even if they're ethnographic studies, CAP stories. I think it's really important. If you look at one of the major issues and challenges with reporting on evidence from science journals, it's always that the negative findings of studies are left out. We all know that as science journalists. So unless a study delivers something positive, particularly if it's a story on whole wheat grains and it's funded by Kellogg's, you're going to see a glowing story, and that's what gets into the press. And it's a huge loss to science that we don't read about those studies that have failed or failed to come up with sufficiently encouraging findings about anything, or who are unequivocal or ambivalent, let me say, ambivalent in their findings. And I think as far as women are concerned, we have to look for those kinds of positive stories and positive framings, and that's what's really missing in our gender reporting. On the other side of it, I think we really have to dig deeper into what's going on in the not so well covered populations in the country, go into the indigenous communities and really allow the women to speak for themselves. I mean, I don't know many. I mean, let me be a little provocative and ask, as journalists, when we go into those communities, there's always a distance. Our education, our urban outlook, our expectations of what we think is good health and a happy life or attainment, and then, the person that we are interviewing is always several steps below us. We feel not so much empathy as sympathy and pity, I think, although we may not articulate it, and I don't think many of us acknowledge it to ourselves. And I think that creeps into our reporting, that feeling of otherness. And I don't think we recognize the pride of those women, and we don't respect those women enough. Even if they're suffering, we portray it as something very pathetic. I don't know if I'm making sense here. I don't know, Banjot is probably going to fight with me, but I think what they're going through has to come out, but I would personally prefer that they say it in their own words, rather than us using UN language or UNICEF language or the very jaded, stereotyped way of portraying these women. I think that the tragic experiences of women in health have to be portrayed in all their color and all their glory, as said and felt by the women themselves. There's a huge paucity of data, I think, on certain aspects of gender and health, and we really have to flag up both psychosocial research gaps, ethnographic research gaps. I mean, there's a huge bunch of women out there in the country about whom we know nothing at all about their health, about what they feel, what they eat, what they drink, how many miles they walk. We have no idea. So I think there's several media dark areas that need to be picked up and covered, and we need to go and look for those researchers who are actually interested in that, who are, just like Kavitha works in neglected infectious diseases. There are probably those researchers who are going to places where others have just left out. Or what I'm basically trying to say is there are nuances in the experiences of women and health across the country, and we can't broad brush, paint them all with the same brush, using the same stereotype terms. I think we have to drill down into the nitty-gritty. And one of the interesting outcomes there might also be that we discover strengths in these women, and we may discover local solutions that they have, that they are using very well for their own health, which are all signs of community strengths. So I think those things have to come out as well. So I think I've been provocative enough, and if I want to go the usual well-trodden path, I can, of course, end by saying, yes, we are, I think, 146th on the Gender Gap Index. Our women are not doing so well, including in newsrooms, in terms of occupying leading positions in newsrooms, and that tells on our health, because we know we work twice as hard, we stay up, we look after the baby, and we work on Sundays, and still we're not getting that promotion or getting assigned to that particular story. It's telling on our health. And health, as we know, is connected to our physical health. And yes, we do come down with asthma and allergies and depression. And I think those stories need to keep getting told as well. But we need to support that with good evidence. And I think we need to promote those researchers who are looking into those things. So I think I'll stop there. I think I've put a few things out, and I'll now hand it back to Padma. Thank you very much for your attention.
Thank you, Jaya. That is really fascinating. If I can just put one small question with a very quick estimate. Yeah. From your talk and generally from our observations, our health reporting seems to be focused on either medical research and what it's coming up with, diagnostic kits, treatment, vaccines, etc., or physical infrastructure, etc., shortages, etc. And the social science aspect that you referred to is occupying a minimal position. So if you were to assign percentages to the first group that we seem to be focusing on and the second group we are not focusing on, how would you put just a number? Quick answer and then I'll pass on.
Well, as health journalists, I would put it somewhere around like 10%. 10 to 15% is all. I mean, I hate to generalize like that, but I think, there's a lot of gender studies and research there which we are not connecting to the health field. That's what we're not doing. Okay. I think both the arms have not come together to clap, and I really think this is why I'll give you one quick example. In the National TB Control Program, RNTCP, we've actually worked over the last 5 years to bring in something called a gender framework, which is essentially a gender audit of the TB program, and that's what we're talking about. So we took the help of people who work in gender and tried to look at how that plays out in terms of service delivery, attitudes at home. If a man has TB, his wife stays there and looks after him, and if the wife develops TB, he gets married again and she's sent back to her parents' house. So how does the RNTCP deal with all of this? What kinds of policies and programs should be there? What kinds of education should be there? How should the health staff be trained to sort of address that at the field level? So I think these gender audits and gender frameworks for understanding our own policies and programs better are very important. They shouldn't be there just in the RNTCP. They need to be replicated across the board.
Thanks. But that gives us a very good ballpark figure of exactly how loaded the reporting is. So thanks very much. And now we'll turn to Mahima. She will look at other aspects of the health system, such as it is in India, especially looking at access to healthcare and how she's been reporting on how poorly thought out laws finally impact health outcomes. And so now I'll request Mahima to talk.
Hello. Yeah. Thank you, Padma. Jaya ma'am just kind of spoke a lot about gender and how the two arms are not clapping or coming together to clap. And I'd just like to add a little bit to that before I speak about other things. For example, lately I've been looking a lot at gender-based violence and health system response. And there is a lot of NFHS data which literally points out at how many women access health. And again, this is, we should not be painting like with the same brush, but it shows us, and during ground reporting, I found out that more women who are abused by their partners are likely to access public health systems than private health systems because it's free and the abuser is not going to pay for the treatment. So, I mean, there are these little, these are weird victories, but the health system is in a position to kind of uniquely respond to that problem. But when we look at, for example, that's also the role of the reporter to flag that survivors are going there and this is a health issue and you should be looking at the signs and symptoms, what the survivors are presenting with. But when you look at the Nirbhaya Fund, there is not a single member of the health system in it. You have railways and you have other, ministries on it, but not from the health system. So clearly, we don't see at the central level see it as a health issue, gender-based violence as a health issue. We always see it as a criminal justice, problem. But then what happens is the survivors' experiences are ignored, and that's where I think we are not kind of bringing those aspects together. That being said, the other thing reporters, I think, need to look at more actively, and I try to do in whatever limited capacity. For example, POCSO Act. It's a Child Rights Act. It's to protect children from sexual offenses. It's a decade of POCSO. And overwhelmingly in the last 5-6 years, what's come out is POCSO is criminalizing young adults in consensual relationships. And it sounds like a social problem, but it has a deep health impact, which is that young women then don't access healthcare, and and in SRHR programs in schools and colleges, educators can't tell them that use condoms because it's illegal to even have engaging in those relationships. So what you have then is a lot of young people falling in the clutches of the law, not accessing the health system, not knowing what is good practice, and when are they supposed to seek help and things like that. So I think in every policy decision we make, there is a chance that there is a health impact. And there is a chance that it is going to trickle down in ways we have not thought of. And as a reporter, sometimes it comes out in like interesting ways. And a lot of the POCSO cases, for example, get caught when the young woman goes to the hospital with a stomachache. And it's not a stomachache, she's pregnant, and then she's scared, and her partner is kind of thrown into jail because the male partner is always the perpetrator. In the eyes of the law, it doesn't matter that this was a consensual relationship. If it's under 18, the man is the perpetrator. So there have been cases where there were 2 men involved or 2 women involved, and they did not know. I mean, I'm talking about teenagers, and they did not know who to call the perpetrator in this case. So I mean, laws present interesting, result in interesting kind of applications on ground, which causes a lot of health issues. So that's one thing. The other thing, for example, the ABC rules, and that dogs and dog bites are a hot topic in the media. We report it nonstop. But as we were discussing earlier, like it just stops at dog bites, X number of people. And in journalism school, we used to say dog bites man is not news, man bites dog is news. But now in India, the problem is so huge, but our reporting stops with dog bites man. We are not talking about the fact that, our ABC rules may be inadequate. Is there research to show what kind of things we need to do? I mean, these are all health stories. These are all One Health stories that we need to constantly talk about. So there, as a result of this, there's also, especially with dogs, there's a lot of misinformation and confusion around what's right, what's wrong, what's ethical, what's not. So it opens up a whole range of stories to do, but we don't see those stories. We only see it to, okay, this dog was bitten, or the Residents' Welfare Association is fighting amongst themselves because dog feeders were not allowed to feed the dogs. But what impact does it have on the dog population? We don't understand, we don't communicate, we don't report on it. I think I'll stop there. Yeah.
Okay. I have a question for you about the first point you raised about, a POCSO Act. So in such cases, as a health journalist, because sometimes the editors drill into our head data and evidence and where have you got your information from, is much of the reporting then based on some individual cases that you have come across on ground? Do the editors insist on data, or how do you back up that case study with more background information?
Yeah, so with the POCSO Act particularly, there have been studies in 5, for example, done by NLS Bangalore, which show, and also the data from POCSO shows that 80% of the cases registered under POCSO are of teenage girls, where the teenage girls are the victim, and age of 12 to 18. So it raises the question that, does that mean young children are not being abused? Clearly, those are not being reported. But what is being reported is these teenagers, because at the end of the day, like that's where the society and the moral policing of young women's bodies comes in, and which obviously, and then there are also studies which have looked at the judgments and seen what happens when these cases come in, and what do the judges do. And many of the cases, they are dismissed, but if the age gap is too high, again, these are very arbitrary decisions. And earlier in the parallel session, ma'am was talking about the wind turbine syndrome, and how the judge did not, in France there was a case where a couple was awarded some 100,000 euros in compensation because they said that they had the wind turbine syndrome because they were close to a windmill, but no such syndrome exists. And the judge did not go and verify that or did not call in an expert. And that seems to be happening a lot in our courts, where the judges or the lawyers kind of, they think that they know the subject well, but they don't. You don't know our bodies. You don't understand, what is happening between the ages of, also just having a child, calling 0 to 18 as children in one bracket itself is problematic. We know so much happens between that age. Like, we develop far more between 0 to 18 than 18 to 60, apart from, yeah.
Thanks very much, because that's a very nice, useful tip you have given, because we tend to restrict ourselves to medical institutes and researchers and studies and peer-reviewed journals, but it would be worthwhile to also look at some legal contacts, legal institutes and legal data to then check how laws are how they're playing out on the ground level. And how it's a multidimensional issue, and we shouldn't remain fixed in our boxes of research institutes, journals, data, evidence, etc. And now Banjot, she has been doing a lot of reporting, especially on COVID, and she has been listening to, which certainly had never been a neglected disease, but also we have heard Jaya talk about gender issues, and we've heard Mahima talk about laws. I would like you to share your experiences. Sometimes we came across this point by more than one presenter about lack of data, but it goes a step also, even if there is some data, there is lack of access to that data. And beyond that, about vaccine inequities. Who were the ones who got the access to the medicines, to the vaccines, etc. So please share your experiences.
Thanks for inviting me. I still remember that phone call from Jacob asking me, Banjot, will you come and talk to us? I told Jacob, in any case, we talk so much over phone. Why do you want me to talk about it all over again? So it was Jacob calling, and it was hard to say no. But yeah, thanks for inviting me. Pandemic is over, long over or not, I don't know, but it seems to be over at least, and we don't want to talk about it anymore. Because those were some very eerie memories or nightmares, if I would say. But, as this whole phase started from January 2020, although we call it COVID-19 for 2019, it was the fear of unknown among everyone, among doctors, among scientists, among journalists. Because, at the end of the day, we are journalists who might not necessarily have been equipped in their J schools with all the science that we write about. So we literally had to go hunting for the scientists to explain the very basics of us. And 3 years, 4 years down the line, I have to say this, that whatever we wrote and whatever good, if at all anything good came out of it, we stand on the shoulders of those giants who used to speak to us and who used to talk to us, in a manner as if they would teach their students. A lot of scientists, a lot of experts spoke to us, and we really owe a great deal to them, and I must say this now. As a journalist, to begin with, as I said, my biggest challenge was to know the unknown, whatever was known, and then to write it in a manner in which common people would understand. Even now, this is the biggest challenge for me as a health journalist, to democratize the writing. At times, we tend to write it in a manner which is, if I may say, elitist, which a certain section would understand, which scientists would understand, which journalists would understand, but maybe not the common people, and this goes beyond health journalism, I feel. Even in climate change, even in environment reporting, I dread to read some of the, financial stories, because even after having read them twice, I get hardly anything out of them, and then I think, oh my God, am I also writing like this? So there are stories which I read and I realize what not to do, at least in my stories. I still have a very long way to go in that, But that is one of the biggest challenge for me as a journalist, as a health journalist. About data, a lot of my fellow panelists spoke about data is a huge problem. And it's as simple as that. If you want to know about dengue cases, what do? You go to the website of National Vector-Borne Disease Control Program, NVVDCP. If you go to the website now, you will have figures updated till maybe September. We are in the month of November, and we were in a time in which the cases were going up fast. So was it, and we do know that the central government, these programs collect data at least on a weekly basis, if not in a lesser frequency. Now, if this data is collected on a weekly basis, why should in the month of November, dynamics were changing? On top of that, if you see that web page, you will have data for all the states. As somebody, sitting in Delhi or maybe centrally, if a researcher wants to look at the district level data, where does one access? One can't do anything. You write emails go to junk boxes. I don't know where do they land. Certainly they do not land with the people who can give us that data. So it's not that the government does not have the data. The problem is they don't want us to look at the data as simple as this. So you go back to pandemic, one of the most critical features to look at the severity of disease at any point in time was the hospitalization numbers, besides death. Not once in the pandemic we had access to data which could tell us what was the hospitalization number at given point in time. Not once. Especially in the third wave, there were many, but third wave, the Omicron wave, death was not the point. The point was if people were getting hospitalized in greater numbers. We couldn't say anything. So, and even, I thought, okay, we are poor journalists, poor fellows, we don't have access to data. Maybe scientists have. The people sitting in the ICMR would tell us, no, we don't know. So, when, there would be so many, I hope people don't take offense as if there are so many consulting agencies sitting in ministry compiling data, how big it was a task to give the hospitalization number data. Even today, if you go and ask how many people were hospitalized in India due to COVID-19 at a certain point in time, most probably will not get to know about it. You're talking about, data. There was something very crucial called genome sequencing. I remember Jacob writing a story on that. Jacob sourced that data from the government website. He did not manufacture it on his desktop. He sourced the data from the government website, and the next day or perhaps 2 or 3 days later, we have the chief of NCDC saying, oh, this story is wrong. It was sourced from the government website. The story was perfectly all right. But just because somebody wrote about it and perhaps painted in a picture that you did not want it to happen. So, A, you don't have data, and B, if you somehow by some good luck you are able to find it. By the way, that portal is closed now, if I'm not wrong, Jacob, isn't it? So now if you want to go back and see how many samples were being sequenced for genome sequencing, you will not get to know about it. That portal doesn't exist. There exists a different portal, but that is quite different and doesn't have that much amount of real-time information which the particular portal used to have. Then in pandemic, one of the biggest challenges was to be, to quick, but then to be accurate. There was a time when, and this was, for example, in the third wave, when we thought COVID had sort of come back with the Omicron wave, a death happened. The particular state concerned where the death happened, they confirmed that death happened. Most of the journalists wrote about it. And then in the evening, the health ministry would send a press release, or there was a press statement or a press release saying, no, that death did not happen. Now imagine the dilemma of a journalist. The state government is saying that death has happened. The central government is saying that death has not happened. One single death. So is it so difficult for state and central government health officials to make a phone call and then to decide whether the death has happened or not? Or to next day issue rejoinders to stories saying, oh, the death did not happen, and the journalist wrote about it. So, this whole kind of paradigm of confirming the thing and yet not confirming the thing, and if I may say, deliberately trying to confuse the journalists, was something which was very difficult to handle back then and perhaps even now. Kavitha ji was talking about the experts, it's very difficult to find. I said in the beginning that our work stands on the shoulder of some of the giants, but it's very difficult to find. And now the time is such, some of them were really kind, but now the time is such that if we speak to them, and these are like independent experts, not associated with any government institute, they will say, okay, we are giving you the opinion, but please don't say who I am. This is not a government scientist. If a government scientist tells me this, I can still understand that he or she is not authorized to speak to media. But if somebody, and I do not blame that expert also, because the time is such, the fear victimization. So if in a time where as journalist, it is my limitation that I am not able to find the right expert. But if at all I am able to find the right expert, the expert is not ready to go on record for the fear of being victimized, then you cannot give a quote in vacuum. Then your editor or your desk will ask, and fair enough, to ask who gave you this quote. So, we are becoming, we are landing in an era where it has become very difficult to write because we do not have people speaking up. And if people don't speak up, we cannot become story. We cannot write, even if I know the fact that, the fact that the person may be speaking may be very well known to me, and I am good enough to write it on my own, but I can't. So that is a challenge which we face even now, which we faced back then.
Banjot, I think we have
just one last point. Spoke so many about others, but there is a lot of things that we as health journalists also need to look into in our own craft. Since I was talking about pandemic, once I dialed a scientist, and I used to have long conversations with the scientist. That day, the scientist was very angry. And the question posed to me was, do you people realize that you are making cardiologists to speak on vaccines on TV channels? I said, I at least haven't done so far, and I don't believe I'm going to do so also. But I take the blame, and I said sorry. So we are so poorly informed as health journalists that we do not know whom to speak to for what. Clearly, a cardiologist can't speak about vaccines, vaccinology, immunology. I mean, they would have been trained about it, for sure. They are better than us to speak on it. But not to speak on TV channels. So, and then, as one of the editors described it in a podcast to me, at that time, health beat had become like Kashmir beat. Everyone wanted to write on health. Whether they had written on, in this area previously or not, they wanted to write on health. And we saw mistakes coming from senior editors, left, right, and center. Jacob for sure knows about it. They are using terms loosely, which would mean something else. They would have definitely meant something else, and they were grave errors. I hope that, every newsroom, big or small, has a health journalist. So even if editors, some fine day, decide to write on something that they want to, if it is something like, say, health, environment, climate change, they must consult their health reporters or environment reporters or climate change reporters. So we need to democratize, perhaps to an extent, the newsrooms also. There's a lot to be done, to be invested in health journalism. So I think since I've already crossed my time limit, so I'll stop here. Thank you so much.
Thank you very much, Banjot, and you have addressed the elephant in the room. That is the fear of experts, even the original experts, never mind cardiologists speaking on vaccines, but even the original experts, and now, they're reluctant to speak to the media, shouting angrily at journalists. Many of us, I don't know how many of you have faced it, but I have certainly faced it for something I have not written. I mean, in the first place, somebody else wrote somewhere else, or somebody else wrote in the publication that I happen to write for, but that doesn't mean you yell at me. But anyway, all these are various elephants in the room which we are not addressing at the moment in this panel discussion. Maybe next conference, Shubhra. Yeah. Yeah, not this panel, yeah. This panel. So now I think it's time for all of you patient colleagues who have been listening to everyone, please pose your questions to the panelists.
Thank you, everybody, for this very enlightening discussion. So I just wanted to, ask your thoughts on this particular problem which Banjot has kind of referred to, which is that health is related to science journalism, especially in the newsroom when, health and science journalism and environment, we are all kind of clubbed together. So at one point of time, it was always simple. It was just about finding experts, get the facts, write to the best of what you know then. We always know that these issues, tomorrow's story is not the same as today's story. But what happens when diseases or scientific developments become geopolitical tools? And this is what was very unique about COVID, because it somehow became about, how is India faring versus vis-a-vis other country? Have those guys done better than us, or we have done? So where is the role for experts? Where is the role for scientists? And how do we as journalists continue just doing what we used to do before? That is, just ask people, get their independent opinions, use our own experience to find out if somebody is exaggerating or is just, stating a point. How do you see us being good journalists, especially in an era when information and what is considered fact and science is manipulated far more than just journalism, but about preserving countries' integrity or questions like that? So anybody?
You have hit the nail, because if you talk about social media, I remember if we would write about certain fallacies with our vaccine programs, then we would become agents of big media, a big pharma. And if we would write stories educating people to take the vaccines, which are well tested, then people would say, oh, you have not done your homework, you are promoting something which is not adequately tested. So what do? Do we write? We do not write. What do we do? So yes, that is a dilemma, and that makes, I completely agree, that makes our work much more difficult. When I go back to this COVID death estimates, excess death estimates, when they came out and they said, WHO's estimate, for example, said India's had close to 4.7 million deaths, 10 times more the official figures. You had a whole barrage of health officials from the Indian government saying, oh no, WHO is wrong, every previous study is wrong. And then if you write about them, then you become quote unquote anti-national. You are exposing, our own fallacies. So yes, it's difficult, and it's definitely a geopolitical tool where you are assessed not on the basis of what you have written, but who has written it. So it's difficult. I think then again we have to go back to the good old days of just listen to our gut sense and then speak to experts whom we have long known for their integrity, to check our own biases, and then perhaps rely on them. I really don't know what more we can do.
Would anyone else like to add, or?
And that's a huge challenge at hand. No single answer would be the right answer for sure. But another thing I don't know, as an organizer, as a group, because you say you're always stronger as a group, right? So as a group, scientists, the Scientific Journal Association, can they have their own real experts who are experts in areas, and they're really deep domain experts, so that your back is covered by science, your back is covered by evidence, your back is covered by facts, numbers, figures. Now when you interpret those figures, you have a rationale for that. So my only suggestion would be supported by as strong science as you can be, rather than I would say no Nara is really a science.
Like that I would agree, but I would also add that when you are backing with science and data, my experience has been then you're accused of cherry picking. That you have gone and picked that particular data and that particular evidence to back your theory. You know, it's really a hard battle that we are fighting. Yeah.
Yeah, I just wanted to comment on a couple of things that Jacob flagged up and Banjot also. To me, it's like very tempting to get swept up in this politics of this whole thing, vaccine nationalism and this competition and so on. And then sometimes I, try to sort of come back to earth and ask myself, what is the science behind this? So we all know as science journalists, you can't compare really two surveys which use different methods of estimation, right? So you can't compare a household survey or a community prevalence survey with a sentinel surveillance survey, for instance, because they're going to give you really can't compare them. There are two methods. One is going to give you a gross overestimation of a disease, and the other one is probably going to lower it. So I would say when the problem came about this excess deaths for COVID, I think maybe as science journalists, this is a great opportunity for us to sidestep the politics and really shine as science journalists by looking at how did the excess deaths, how did scientists come up with that data and really explain it to the public. It was a great opportunity to promote science literacy among the public. This is how they reclassified the deaths, the definitions, this is the definition they followed, and they came up with so many more deaths. For instance, a death which, an elderly person, we talked about this in the morning, an elderly person with a pre-existing condition like a heart disease coming down with COVID, did the private hospital classify that as a COVID death, or did they classify it as a cardiac death, right? So by just changing the categories, you can lower the number of COVID deaths and increase the number of cardiac deaths, for instance. So maybe we could have also dispassionately just said, this is how India classified the deaths and pointed out all the problems with this. And more than half of our population goes to the private sector. Half of them weren't notifying the deaths, also because on the requests of the families who didn't want to be seen as somebody who had a COVID death in the family. And so maybe it was a chance to sort of share and, all of these issues with how these estimations are made and use it as a chance to promote science literacy. And I think we lost that opportunity.
Thank you. Next question.
When COVID and data are talked in the same sentence, that's all we are going to talk all night, right? So what I wanted to come in at is, we've discussed the many layers from which we report health. It's very much like we look at insurance papers and see what kind of earthquakes has happened in some area. So it's very much like what you do with law, figure out POXO and then see what it could have as a balance in, say, adult or young adult health stories. So my question to the panel is, when we're looking at health as a story and as a beat, there are so many layers we can come at it from. At the same time, it's very difficult sometimes. It's easy to say, back your story with science. When there is no science, no data, what do you back it with? You just back it with some sort of estimates and your own, perhaps. And you said dispassionate. That's something that doesn't go hand in hand with lack of data, right? You suddenly become passionate about, where is my data? And where can I get it from? So what I'm saying is, for health journalists in a newsroom struggling to figure out where to sort of pitch their story to the editor, many times the editors will have to also be convinced. What do you think is the best way to go about it? Not just data or the passion or the layers that you all mentioned, but do you think health stories also need to become something like what we have been talking about, environment stories with multiple heads, not just labeled as an environment story, but also could be a political story, could be a financial story, could be a health story, whatever. So, yeah.
I think one thing that health journalism offers is an access to a wider audience, because all of our readers want to lead healthy lives. They are interested in basic health issues, they are interested in what affects their elderly in the family. So it's a great opportunity to enter and talk to them about science. And as ma'am said, we lost an opportunity with COVID to kind of really take that and go with it for other diseases, for other, issues. So at the end of the day, for me, health is also human interest. And I open generally with human interest and then go into the health layers. And that's what I do with editors. I work as a freelancer, so I think it's a great opportunity to talk about all sorts of, and it's also very, it can be made very intersectional and multidisciplinary, and you can look at it from 5 different angles.
Just to kind of take the argument forward what Jaya ma'am made. And for example, the death estimates story, it was a big thing. Some of the journalists in some of the news stories did delve into the methodology part. They did delve into the CRS. They did delve into all the sources, why WHO had to do modeling, how the other studies which had come up with similar estimates, they did their studies. Some of us did write that. But then the problem is how much of it will be read. We can control what we write, but we cannot control who and how many will read us. We certainly can't. We talk about, just to give another example, we talk about misinformation and fact-checking. I mean, without talking about the issue, even if I fact-check or if I have fact-checked that statement coming from one of the top ministers of the country, the statement has been fact-checked, the story has been written not once but twice, but if the government and its ministers goes on to talk about the same thing again and again and again and again and again, then that debate or the battle is not about what are you writing, it is how much of it is being read and what is the scale of the communication. So I think that's a challenge which we journalists are also dealing with. Yeah.
I'll just also add a couple of points because I always wear that here of the hat of neglected diseases. It was usually not possible for Ministry of Health, I would say, to work in isolation or for health to be seen in isolation because of the impact of environment, because of the impact of social determinants, because of impact of nutrition, of housing, of water. So in fact, health is one which is really very strongly intersectorial. Just saying it is a drug or a diagnosis which will help you is usually a very big undercut. So very classical example of leishmaniasis. If people live in pakka houses, the vector will not multiply. If there is no there's no, so Ministry of Housing gets interested. So it means, do all our people living in pakka houses, do we have the vector rightly controlled? Have we sprayed even in that to let level? Do we have removed the ditches? Have we followed up actively the patients, a community worker? So there are so many facets to one of, I think health is the most interesting to cover. Had I not turned into an R&D person, I would have gone there.
So thank you all. I think this leads us to the more open room kind of session where everyone gets a turn to speak or a chance to speak on whatever they think is important. But thank you all for listening, and thanks to the panelists because you raised so many very different fascinating points, and I don't want to waste more time listing all of them because I'm sure all of you have also picked up something that struck you as very important. So thanks to all the panelists. Thank you all for listening so patiently to us. Thank you, Shubhra and the entire team at SJAI for organizing this. I'm sorry I couldn't spend too much time in this conference, but I hope to make up for it next time. Thank you all.